Welcome to Stethoscopes and Student Standpoints, the official podcast of the Alberta Medical Association, AMA, Medical Students Advocacy Committee, and the first ever inter-school podcast led by medical students in Alberta. My name is Sana.
And I'm Abdullahi. This podcast is where we as medical students take a stand on the biggest issues in healthcare, medical education, and advocacy, bringing in real conversations from both the University of Alberta and the University of Calgary.
And it's funny that we say that because we are both actually from the University of Alberta. And if you could see Abdullahi's hoodie right now, he's wearing a University of Alberta medicine hoodie. However, we have the University of Calgary students who are on the committee helping us write some of these scripts. So it is not just us claiming that. But if you're a medical student, if you're a physician, or just someone that's passionate about the future of healthcare or just curious, this podcast is for you. So let's get into today's episode.
Medical students have a unique perspective and one that's often overlooked when it comes to conversations about healthcare, policy, and medical education. We're the next generation of physicians, and yet so many of the decisions affecting our futures and our careers and our training and even patient care happen without the input of medical students. And that's why we're here. This podcast is about more than just sharing like a day in the life of like what medical school is like and, you know, the generic medfluencer stuff. We're really here for advocacy and having important discussions about the future of healthcare and real issues us as medical students should be more cognizant of as individuals who will be joining this profession within a few years.
With that said, we would like to give a shout out to the Alberta Medical Association. This podcast is only happening because of them. And that kind of brings us, why this podcast with the AMA? Why are medical students collabing with them? Obviously, medical school is intense. Most people know that. And we're already stretched thin with studying, rotations, trying to have a life. But
trying.
Not very well. But we realized if we don't tell our own stories and start talking about advocacy, who will?
Exactly. The way medicine is evolving and the way healthcare is being shaped with technology, AI, politics, and funding, it's all directly impacting us. And there aren't a lot of platforms where medical students can give opinions to share their voices to the individuals that we want to hear them, right? And so having this podcast in collaboration with the AMA and having their support and having them be able to directly hear our voices is how we can have the biggest impact.
Exactly, because you might think, why hasn't this happened before? Is it that medical students are just not interested? Is it that people don't want to give us a platform to stage our voices? And it's actually neither of those cases. When we brought this idea of starting the podcast, Abdullahi and I, to the AMA, they were very excited to take this on. Sometimes when there isn't a platform that exists, that doesn't mean because someone's tried and failed. It's just because maybe someone just didn't try it before. So that's exactly what this podcast is, taking the leap, talking about advocacy relevant to healthcare that pre-meds would even be interested in, who might be going into the healthcare sphere, or anybody else who's interested hearing how medical students take certain takes on relevant topics. And that's really where the advocacy piece comes in.
Yeah. And speaking of advocacy, the next big question, I think, is what even is the AMA Medical Students Advocacy Committee? And so one of the biggest reasons we wanted to start this podcast is because of the work of the AMA Medical Students Advocacy Committee. And Sana over here is actually one of the founding members of it, or the founding member of it. So I feel like she'd be the best person to tell us about it.
I have a gun underneath the table just making you say that. Just kidding. But yeah, so the AMA Medical Student Advocacy Committee, that Abdullahi is joining us here as a co-founder and host of the podcast, was all created actually because we saw this huge gap. I was the AMA representative for the class of 2027 at U of A. And when I went into these meetings where it's a board of physicians and it's physicians talking about issues that are regarding physicians, the sphere of healthcare, and how they can advocate for the patients, ultimately, they started discussing social media, and I saw an opportunity there. They were talking about some of the limitations with their current resources, and I thought to myself, medical students will do this. They'll want to get their voice out there because it's not already out there, and it can be good for the AMA and it can be good for us, and that's kind of how we started.
Yeah. And it's not just about having discussions as well. That's just one part of the thing. You can talk about a problem for, weeks on weeks, and that really won't change anything unless we also take action as well. And I feel like that's what the AMA Student Advocacy Committee allows students to do. It gives them that means of having a pathway to making the change they want to see happen, having an outlet for advocacy, right?
Yep. That's for sure. So why don't we give the listeners some background of what the AMA Advocacy Committee does and how we started. So we started up with just an Instagram, and we were making posts with our own account, the AMA Medical Students Advocacy Instagram. And we were pushing for primary care and advocating for having more funds in Alberta allocated towards it. It's really interesting because it was the first time that U of A and U of C students actually had an inner school club, which is crazy. There's only 2 schools in Alberta. You would think that it would be easier to get us together, but being in the different cities and having different workloads completely, it's quite difficult. Yeah. So we started on the Instagram there, and then we decided to get on a website and have just medical students in general be involved and send us their general opinion pieces or just pieces writing about any advocacy efforts they've been part of or believe in, and having that all published on our own official site that the AMA endorses and helps us push out to just the general public so they know how medical students think. And that was really what was revolutionary. It's hearing everybody's voices, not just the people on the committee, but the rest of medical school. And that takes us to the podcast. Abdullahi, why don't you tell us a little bit about that?
Yeah. And so a big part of what this podcast is doing is bringing these discussions surrounding advocacy, surrounding hot topics, surrounding concerns that not just me and Sana have, but a lot of the medical students at the U of A and at the University of Calgary have, and giving us that outlet to have these important discussions, and hopefully inspire change as well through these discussions. And because at the end of the day, a lot of these issues, they're not just affecting medical students, they will affect our future patients and our communities and the entire healthcare system as a whole.
So we've said the word advocacy a lot. What does that actually mean? I get a lot of people that approach me and they go, okay, you're helping with the Student Advocacy Club. What are you advocating for? Fair enough. Good question. And the answer to that is not so straightforward. We are advocating about everything, but on this podcast, we want to highlight specific topics that are most relevant to our listeners here. So what can we expect this season? Abdullahi, why don't you tell us a little bit about that?
Yeah, so I think first up, we plan to do a deep dive on what it's like to be a medical student in 2024 and to give our listeners sort of some insight on where our perspective is coming from and that background context. And I realize I said 2024, it's 2025.
Just a little behind.
Yeah. And yeah, just what a typical day it looks like to be a medical student. What are the challenges we're facing, and how medical education has changed over the years.
Yeah, and that's going to be our first episode there, where we're just going to do a day in the life almost to give everybody inside look into that. But then in our further discussions throughout the podcast, we'll have one episode on the acute care crisis. I'm sure everybody listening has perhaps gone to the emergency room at least once, and it's not uncommon news that emergency rooms are overwhelmed. Wait times are atrocious. They're only getting worse, but the doctors themselves are already stretched so thin. So what does this acute care crisis in Alberta look like, and what does this mean for patients and future doctors?
Yeah. And another big topic we'll be discussing is the future of AI and medicine, and how we are going to be able to change the way we practice and help the medical field grow with AI. I feel like in first year, like the first month of first year, the first question everyone would ask all the time whenever we had a speaker who was coming in from like the radiology department was like, is your job going to be replaced by AI in 20 years? So I think having these discussions about how us as the next generation of physicians can sort of incorporate AI and use this tool to improve the quality of care we're giving to our patients, because at the end of the day, that's the most important thing.
Totally. And ChatGPT is really just taking over everything, the whole release of Gemini. I caught my parents the other day. Their first language is Persian, and they were speaking Persian with ChatGPT, and it would reply back in just a very funny English accent, but knew and understood everything. So I think there's a lot of potential there, and I'm really excited for that episode talking about how it's going to change healthcare and the implications there. But what else are we going to be covering in this podcast? We're just trying to give you a general overview of everything that's coming up this season, so you have a little bit of a taste of the podcast. Specifically, we're going to go next into a little medical student advocacy and activism. How can we get involved in shaping policies that affect our training and careers? It's a lot to talk about it, but we need to actually do something and not just talk about it. So we're going to break that all down, and that'll be a really useful episode for the medical students and for anyone else curious about what the future is looking like. And that's not all. There's going to be several other episodes we haven't mentioned, but this is a nice little sneak peek into that.
A lot of exciting things coming from this podcast. And I think the next natural question you guys are all asking yourselves now is, why does this podcast matter? And why should people listen?
Yeah, and in order to answer that, we'd say that these conversations are happening behind closed doors every single day. Healthcare policy is being shaped, and that's a lot of government and a lot of policy. It's a lot of the medical healthcare sphere collabing with them. It's not just physicians or just nurses that are involved in this. It's a greater story than that, and it's evolving. So patients are the people who are being impacted by these decisions that are made at every level. And medical students are often not heard as much in these discussions because we're so early in our training. But it's important as our future jobs and as the future of healthcare that we become fluent in the issues, figure out what's happening, and give our takes, and make sure that it represents what's best for the patients.
Yeah, I couldn't have said it better myself.
Yeah, and so we're not just going to talk about problems, right?
And we don't just want to discuss problems like we mentioned earlier. We really want to understand all the different perspectives of all the important stakeholders involved in these situations, understand where are physicians coming from, where are the patients coming from, where are the medical students' opinions coming from, right? And we really want to offer and discuss potential solutions of things that we can do as students to help make a difference and to help make a change. And so ultimately this comes down to, surprise, surprise, how can we advocate as medical students?
Yeah, well said. And we want to create change, and that's what this podcast is there to do. And that's essentially what we wanted to introduce you today in this introduction episode.
Yeah, and I guess that's our intro. And we're just so excited to finally bring this podcast to life. This is something me and Sana have been talking about for a little while now. So
yeah, we needed a platform to talk. We didn't have enough time. So here we are. And if you're interested in healthcare, medical education, or you just wanted to understand what it was like to be a medical student today, this podcast is absolutely for you. Our next episode here, we're going to talk you through a day in the life of a medical student, talk about some advocacy pieces, talk about schedules, things we wish we knew before starting, and what really happens behind the scenes.
Yeah, it's not as glamorous as House MD or Scrubs.
Exactly. And yeah, that's it for today's episode of Stethoscopes and Student Standpoints, the official podcast of the AMA Medical Student Advocacy Committee. If you found this discussion insightful, make sure to subscribe and follow us for more conversations on medical education, advocacy, and healthcare reform. If you're listening to this via the AMA links or via our website, be sure you check out the other great articles we have on there.
Yeah. And because this is the first inter-school podcast by medical students, we also really want to hear from medical students. And so if you have a topic you want us to cover, or if you want to come on as a guest and speak about something you're really passionate about, we'd love it if you could reach out to us. And this can be through our email or through the AMA Medical Students Instagram page. So yeah, keep the questions coming, keep advocating, and let us know if there's anything you'd like us to cover.
So check us out on amamedicalstudents.ca. Thank you, and see you next time. Bye.